Wisconsin health officials say teachers should not wear N95 face masks to school this fall. But a scientist at Duke University says that advice makes no sense. Fox 6 investigator Brian Polson shows you why some teachers want to wear the same face coverings that doctors and nurses are wearing, and why at least one local school district won't let them.
Perhaps it was an omen.
I'm mad. I'm scared.
The way storms pass through Whitefish Bay just as teachers return to get their classrooms ready for the fall.
Can I even work? Can I go back to work? Do I need to quit my job?
That's the voice of a teacher we'll call Angela, who is angry at district leaders over a policy that caught her by surprise.
I think a lot of people are scared and just confused about why.
Since the beginning of the pandemic, the Evers administration has stuck by the mantra.
We're going to listen to the science.
But their guidance on face masks has at least one scientist scratching his head.
So that doesn't make sense to me.
Dr. Eric Westman is among a team of researchers at Duke University who devised an experiment to answer an important question.
How good is the mask that you're wearing?
They shined a laser beam through a sealed black box and had test operators speak into an opening.
Stay healthy, people. Stay healthy, people.
Then counted the breath particles that passed through the light.
You actually do express particulate matter or droplets when you speak.
They repeated the experiment with 14 different masks, but one result got the most attention. This fleece neck gaiter actually spread more breath particles, they say, than wearing no mask at all.
We didn't anticipate that some would be really bad.
Dr. Westman says most of the masks they tested performed reasonably well, but the best was no surprise: the N95 respirator.
I would want someone to wear the best mask that they have, scientifically speaking.
Greetings, John Thompson here, superintendent from Whitefish Bay.
Whitefish Bay settled on a hybrid model for the fall, both in person and online, to cut down on class sizes and increase social distance.
Staff and students will be wearing face masks.
No surprise, face masks are required, but what surprised some teachers was this: the district will not allow them to wear N95 respirators, even if they bring their own supply from home.
You know, it's one thing to say, like, N95 masks won't be provided, but it's like the next level is when it says they're prohibited.
It makes no sense to me to tell someone you can't wear one, because it is better protection.
When the Fox 6 investigators asked Whitefish Bay schools to explain the N95 ban, they gave none, just sent a copy of the memo we'd already seen. The Wisconsin Department of Public Instruction said it offers no specific guidance on what types of masks teachers should wear, and the state teachers union simply said schools shouldn't be open at all.
We really recommend that people would continue to wear their cloth face coverings.
The only guidance we could find comes from the Wisconsin Department of Health Services, which says N95 masks should be preserved for doctors and nurses.
N95 respirators really work best in a healthcare setting where someone is able to be fit tested. And so are not necessarily the best thing to be using in the school setting.
You get better protection if it's fit tested, but the material still gives very, excellent protection if it's making a good seal without the fit testing.
Dr. Westman says N95 restrictions should be limited to areas with an ongoing shortage.
At Duke, where I work, we had plenty.
In Wisconsin, the number of hospitals reporting less than a week's supply of N95s has hit an all-time low.
I want to be able to protect myself as best as I can so I can protect my loved ones.
Angela has access to her own supply and says if she has to teach students in person, she wants to be able to wear them.
It makes me frustrated that people aren't taking the risks that teachers are going to be exposed to seriously.
She hopes speaking out
Stay healthy, people.
won't be a waste of breath. Brian Polson, Fox 6 investigators.
When it comes to COVID-19, the CDC warns against wearing N95 respirators with a valve designed for exhaling. That's because the air they release could still spread disease. However, the Duke study found that even a valved N95 did as well as most cotton masks for blocking breath particles.